everyone to our program today. Thank you for taking time on this gorgeous Thursday to be with us. And we want to make sure we give you some great information today. And before we go into it, we want just to introduce our Place Matters tenants. And if you could put that slide on the screen. All right. Well, while we're doing that, let's go right into our introductions, and we'll come back to that right after. So let's introduce. Oh, here we go. All right. Here are our tenants for Place Matters. So our Place Matters initiative, we want to make sure that our entire community is better off when all of its neighborhoods are healthy and thriving. Place Matters consists of 13 neighborhoods in Northeast Winston. The next piece of the puzzle is complex challenges need comprehensive integrated solutions. And so it takes multiple agencies working together to make this a viable place-based initiative work. Also, a key component is that we are resident-led. So we are doing with rather than for. And I'll say that again, we are doing with rather than for. We're not the experts. We are here to walk with you along this journey. We believe in asset-based community development. We build on the gifts, the skills, and the talents of the residents who live in our community. And we also convene community stakeholders. So that's what we're doing today, bringing you some stakeholders in our community that really care about the situation we're facing with COVID-19 and the vaccinations among the African-American community. So residents, faith-based community, business, and education leaders. So those are the tenets of our Place Matters initiative. And now we'll go into our introduction of our illustrious panel. Thank you all again for joining us today. And so we're just going to do the round robin. So we'll start with ladies first. So I am going to ask Reverend Brown, if you can just introduce yourself and your organization that you're representing today.
Good afternoon, everyone. My name is Reverend Angela Brown, and I'm here as Faith Health NC at Wake Forest Baptist Health. I also am a local pastor here in Winston-Salem, and I also am on our Wake Forest Baptist Vaccination Task Force outreach.
Excellent.
Glad to be here. Thank you.
Thank you, Reverend Brown. Next, we'll go to Miss LaShawn Hairston.
Good afternoon, everyone. My name is LaShonda Hairston with Novant Health. I'm currently an external affairs liaison. Definitely thankful to be represented here today on this panel, and we look forward to a wonderful conversation. Thank you.
Excellent. Thank you so much. Next, we will go to Ms. Susan Gail Perry.
Good afternoon, everyone. Susan Gail Perry. I'm the Chief Deputy Secretary at the North Carolina Department of Health and Human Services. And I'm really grateful to have the opportunity to be on this panel with my esteemed colleagues and to talk about this really important topic today. So thank you.
Excellent. Now we'll have Joshua Swift.
Hey, good afternoon, everybody. Joshua Swift. I'm the local health director for the Forsyth County Department of Public Health, and happy to be here and happy to talk about how our community can respond during and throughout this pandemic.
Excellent. And now, Mr. Edwin Marshall. You're on mute, Edwin.
There we go. Can you hear me?
Yes, sir.
Edwin Marshall, the Forsyth County Health Department. I'm the clinical director here, as well as leading the county's effort to reach marginalized communities with vaccination.
Excellent. Thank you so much, Mr. Marshall. So we'll go right into it. Again, our program is going to be broken up into 4 segments. We'll have time, hopefully at the end, for a Q&A. And so our first segment is entitled, How Did We Get Here? So how did we get here? How do we find ourselves in this situation in terms of a global pandemic So we're going to talk from a global perspective, could be national, state, and local. So whichever one kind of where you fit, please just feel free to comment on that. So how do we get here? So we'll start off with Mrs. Gail Perry.
Well, thank you for that important question. It is amazing to be with you all today and think that really it was really only a short year ago when this pandemic really got legs underneath it, and our state here in North Carolina moved into a state of emergency. I was recently on a call where we talked about it was the 365th day of our state of emergency, and I think for many of us, it feels like a whole lot longer than that, but it really has been really just a little more than a short year that this global pandemic, something unlike anything we've seen in 100 years or more, hit our entire world, as you said. And I think just taking a step back, what we know about how COVID-19 spreads, we know that the main method of transmission is respiratory droplets. So when someone is breathing or talking, that there's more spread with increased respiratory effort. So that's why you see so much emphasis on our 3 Ws, on mask wearing, on maintaining that 6 feet of social distancing. So when people are talking loudly, yelling, cheering, singing, sneezing, coughing, we're likely to see more spread, particularly when that's happening indoors and people are closer to each other. We know that the less likely method of transmission, and we didn't actually know this at first, was the touching of contaminated surfaces and then touching mouth, nose, or eyes, and the airborne particles that can last in the air for extended periods of time. These are less likely, but still possible methods of transmissions. We know that you can transmit this virus if you don't have symptoms. There's a lot of talk about that over time. And we know that we're starting to see in our state, our trends really moving in a positive direction. Very significant declines in cases, really stabilization on the percent of cases that are positive among those that we're testing. And many of our counties are again moving into much lower levels of community spread. So a lot of movement in the positive direction. The things we're still looking out for are things like new variants and how they're going to impact cases and how much more virulent they are, whether they're more deadly, and how the vaccine impacts those. But that's how we got here. Drilling down just for a quick second, I will just say that this pandemic didn't create health disparities and health inequities, but it certainly has shone a light on it. Those inequities start from, years and years and decades of structural and institutional racism that has led to really differentiated and poor disparities in people of color in the United States. And that has certainly been true throughout the pandemic. And we as a state have done an awful lot of work with our community partners on trying to address equity. And we'll talk more about that as we talk about vaccines. But I just wanted to say that going into this conversation. So thank you.
Thank you, Ms. Gail Perry. And we'll jump right to Director Swift. Can you speak to how we got here in terms of Forsyth County? How did we get to this point where we are now?
Yes. Yeah. Thank you, Cedric. So for us, it was actually March 11th. This day a year ago, presented to the public safety briefing that the Winston-Salem Police Department and Fire Department and Emergency Management do. And at that time, the media was asking about COVID, and I said we'd had some tests, that some people had been tested. That evening, Zach Moore, the state epidemiologist, called me about 9 o'clock to let us know that we had 2 cases, people that had traveled to Europe. And so it has been a whirlwind ever since. Just some things of note were early in February, even in January, we started seeing, we saw COVID, or then it was called coronavirus, SARS-CoV, I believe was the exact name, and we were seeing it in China, and we were starting to see it in the West Coast. March 2nd or 3rd, I believe, was the first case in North Carolina in Wake County. And then it wasn't a matter of if, but when. So March 11th, our first two cases, and it was interesting to see how it kind of transitioned over time. I heard someone talking, a lot of people, a lot of us have been able to work from home if we have at least the choice. But obviously this went early on in travelers, people that were wealthy, that had means to travel maybe internationally, West Coast, East Coast. But then it got into people that couldn't telework, that were at high risk, like the health disparities that Ms. Perry was mentioning, that a lot of those jobs were in our African-American and Hispanic community. Especially in our Hispanic community, we saw a huge uptick early on. And some of that was driven by the Tyson food plant in Wilkes County, but a lot of those workers lived here and commuted in buses back and forth. So it's really shifted over time. And overall, we're now at roughly 32,000 cases. We were having 250 to 270 cases per day in late December. Now our average for the last 14 days is 75 cases per day. So we've come a long way. And I know we'll get into the vaccine later on, but it's, and early on, it was probably early June when we had that big spike, June and July, and you saw it across the state. I do think North Carolina in general, the governor has been very proactive compared to other southeastern states. And I think that's helped us and helped our hospital systems not be overwhelmed. But we've had 350 deaths in the county so far. And sometimes that's glossed over, but that's 350 people that don't have a grandma, that don't have a grandpa, that don't have an aunt or an uncle.
Right.
And it's so, and I'll just leave that there. I know the other panelists don't want to take up their time, but it's, it started very small, but it quickly increased. And just my biggest concern is getting people to follow the 3 W's and to do the right thing. The testing early on, now the vaccine.
Absolutely. Thank you so much. We'll jump right to Mrs. Harrison. From a perspective of Novant, how did we get here?
Thank you, Cedric. It's really interesting. What I can tell you that I remember is in kind of December and January of 2019 and 2020, just understanding that we as an organization were standing up our kind of internal task force to really keep our eyes on what was happening. And so it really permeated throughout the entire organization as we began to look at things like supplies and our team members and where they were and the work that needed to be done. And so that planning, I would say, was very instrumental in us being able to quickly kind of pivot our work and move forward to continue to serve the community. It's been interesting, as you all have said, and, it was a year ago today that a lot of things began to change for us. And so, like many of you, I think we were all just kind of almost caught off guard. We had our plans, but didn't exactly know when it was going to hit. As Joshua said, it wasn't a if, it was a when. And so, for all of us, I think, just watching the news, what was happening in our own internal organization, preparing to make changes that would put us in the correct position to be able to serve the community through this pandemic.
Absolutely. Thank you so much. We'll have maybe a few minutes left on this segment, so we'll go right to Reverend Brown and then Mr. Marshall. Same question. How do we get here?
In conjunction with Ms. Hairston, yes, as a hospital system, Wake Forest Baptist Health, we, and specifically with Faith Health Division, me being our community referral coordinator, remember getting some food to one of my patients out in the community who was in need because she had medicine she had to take. And my thought was, what is going to happen to our patients who cannot get out to the grocery stores? What's going to happen with those who are needing to get to doctor's appointments. We all know as a health system that changed drastically what it went from regular doctor's appointments to just particularly specialist visits. And so it put us in a state of we're helpless, and when our resources have been affected, what we're used to connecting our community members with, then it affects the work and how much we can provide services to our people. And so it put us at a standstill. It put us at trying to figure out how to work around and what's the best way to keep us all safe, and come up with whole new game plans of just doing work as we know it, or doing the community outreach from a faith health perspective as we know it. And so leaving time for the other panelists, but it just put us in a place where how are we going to care for our people?
Absolutely.
As Deputy Perry mentioned, that our people became, they were vulnerable before COVID-19. They were without resources before COVID-19. They lacked transportation, they lacked food. And so it sort of took it to a 10th power or more, shall I say, and everything. So we've been lack of resources, but never like that. We have been hurt, but never like that. You're dealing with mental health services or mental health issues, but never like that. And so everything got amplified during that time.
Absolutely, that is great. I think we've all kind of seen the unveiling of a lot of disparities that we thought we had a handle on, and COVID-19 really kind of just shone a light on that. So, Mr. Marshall, same question, and then we'll go into our next segment. How do we get here?
Well, in an effort to not echo too much of what's already been said, because I completely agree with you, from a clinician's perspective, I think that there was maybe oversight in the amount of foreplay we need to have from a science understanding and support of the science behind vaccination, support of the science behind just preparedness when it comes to managing a pandemic. It's kind of one of those things where we know it's a possibility, but don't think it's likely until it happens. So now, here we are, but there are a lot of things that were, undersupplied. So like, PPE with just general education about, or taking the vaccine. And those are kind of things that now we're chasing to get done when we may have had an opportunity to prepare ahead of time and plant that seed so then more people are ready in the event something like that were to happen. So as a clinician, I saw what that looked like. I went to New York to respond to the pandemic almost a year ago in Queens, and I saw exactly how all the I guess for lack of a better term, lack of preparedness. Implemented itself. So now you mix that with a population that have been marginalized and have issues in regard to trust in the institution of health in general, and you have a perfect storm.
Excellent. And yes, you hit the nail on the head, and that's where we're going next in terms of our transition to our next segment, in terms of how are we doing the vaccination rates among people groups and Forsyth County. And again, talking about our African-American community and other minority groups. How are we doing as a state in Forsyth County in particular? And so I want to give this first question to Reverend Brown. What's up? How are we doing in Forsyth County?
Wow, I didn't think I was going to get that. I just knew Ms. Perry was going to get that question. Well, let me take it from perspective of community efforts and community outreach. We, as a community, we did phenomenal. We stepped up to the plate. When from organizations to our churches, across the spectrum, began to be those front line like never before. I mean, and we took outreach to a whole new level. And so where we could not get to stores or things like that, churches became drive-through food pantries and drive-through meals, and we created ministries, and we created different venues to provide these resources to our homebounds, to our non-transport persons who do not have transportation. I think as a community, we really pulled together. I mean, I'm just proud to be a part of this community. Our hospital systems, all of this, I mean, they just pulled together. And every week it was like something new was coming up. You get an email, hey, this is going on in this church, or this is going on in this organization. So I think we did phenomenal. Yeah, I'm just really proud. I think we did very well and really spoke to the needs of the people, and let the people know that, hey, we're coming together regardless of race, creed or ethnicity and economical levels, and we're coming together to provide, and that speaks volumes. And I wanted to look at it that way.
Excellent. Thank you, Reverend Brown. I'm going to jump over to Ms. Gail Perry. Same question. From a state perspective, how are we doing? I know there's some new information out there, I think from Bloomberg, that kind of shed some light. So if you can touch on that, please.
I'm happy to talk about how we're doing as a state, and I do have some specific data on Forsyth County I'm happy to share. I just want to take just a quick step back. I love this conversation because this conversation's making some assumptions that I don't think we thought we could make at first. And that was that there is general community acceptance of the safety and the effectiveness of the COVID-19 vaccine. So I do want to do some level setting there. We know that scientists had a head start and thousands of volunteers helped with the clinical trials. We know these vaccines are tested, safe, and effective. You can't get COVID-19 from the vaccine. I know all of you are living with the reality that our supplies are still limited at first, though they are increasing, but we are wanting to make sure, and we will make sure, that every North Carolinian has a spot to take their shot. So, just knowing that and going into, I think there was a lot of initial concern that we may see things like what we would call vaccine hesitancy among particularly our historically marginalized communities. And again, that is based on the history of, structural and institutional racism, and frankly, some horrific trials and studies that our nation has done, including not the least of which is the Tuskegee experiment. Right. So there was a lot of fear about whether or not we'd see a lot of vaccine hesitancy. And I think what the emerging data is showing us, and what we're seeing in North Carolina, is that in fact, there's more concern or a lack of trust in the fact that vaccine availability is fair, that it is going to be equitably distributed, that people know how to access it, and that the systems are there working for them. And again, with all my partners on this call, that is the work that we're doing together right now to make sure that our vaccines are fast and fair, equitably distributed. So I love that this conversation has immediately moved into an understanding that we do have a tested and effective and safe vaccine, that it's really important for folks to get vaccinated to protect all of us and to get back to the lives that we all want to have with our loved ones and our communities. And now the work is really around how we're doing in terms of equitable distribution of vaccine. And to that point, to your point, Mr. Parker, what I'm very proud of Governor Cooper and Secretary Cohen was really putting a line in the sand and saying we had to have transparency of how our vaccines in North Carolina were being distributed, not just at the state level, but at the county level data. And we hold our vaccine providers, as they know, very accountable for race and ethnicity data. So we have good data. We've been recognized nationally for it. We were the first state in the nation to provide it. And that transparency is critical for building trust, for holding ourselves accountable, and for making sure that we do equitably distribute vaccines. So I will say, we got a little bit of a rough start. And we've had to do some makeup work. I want to be really frank with that. We're really getting to a very positive place now, where we're getting to see those vaccination rates among our historically marginalized communities at the rate at which they are represented in our population, but we're not there yet. We still have work to do. So in a nutshell, right now, what we know statewide is that while white people make up 71.7% of the population, they currently represent 76% of vaccinated people in our state. Black African American people make up 23.1% of our population statewide, and they represent only 16.2% of the people vaccinated. So we have some ground to make up there, that we've seen a very significant uptick in the last 3 weeks. American Indian people make up 1.7% of the population, yet they represent only 0.8% of vaccinated people. And our Hispanic Latinx community makes up 9.8% of our population, but they represent only 3.1% of vaccinated people. So we have a lot of ground to cover with our Latinx population in particularly, but all of our historically marginalized people. In Forsyth County, what we see is white people make up 67.7% of the population, but they represent 74.2% of vaccinated people. Black African American people make up 29% of the population, and they currently represent 19% of vaccinated people. That number is moving up every day. I'm very proud of the work of my vaccine partners, but we got to keep doubling down. We have work to do. And our Hispanic Latinx community makes up 13.3% of the population, but they represent still only 3.7% of vaccinated people in Forsyth County. So I'll stop there. When we get to where we're going, we can talk about some of the events that are coming up and happening right now, but I want to give my other colleagues an opportunity.
Absolutely. I'm going to jump to Director Swift, and then we're going to come to Ms. Harrison. So from a Forsyth County perspective, Director Swift, how are we doing? How do we get, well, how are we doing?
So I'll be brief, Cedric. So one, we started vaccine December the 22nd. The first day we got vaccine, we gave vaccine that afternoon. Mm-hmm. In the first 6 weeks, we took 6 days off, 2 of those being Christmas Eve, and January 1st. So we have the staff at the Public Health Department have been working around the clock. Mr. Marshall is doing, Edwin is working into the community, focused on our historically marginalized populations, going into churches and going to areas, the Watown area, everybody Southeast Plaza, 400 individuals from the Hispanic community, be at the, whereas tomorrow or next day, he'll be NAACP in a few days. So these are by appointments. So we give appointments to these groups and churches to help, because you put a link out there, everybody will come. We've had people from over 70 counties come to the health department and to our fairgrounds. 10 other states, people have come. I'm proud to say that 75% of our doses have went to Forsyth County residents. And then the vast majority of those other counties are 3,000 to 4,000 people from Guilford, 1,000 from Davidson County, others from Surrey, Stokes, and other surrounding counties. As far as my statistics are a little bit different than Ms. Perry's. Not different, it's from the same North Carolina dashboard that's available to everyone. We have good data at the state and county level by demographic, by age group. Right now, 10% of African Americans who are Forsyth County residents have gotten their first vaccination. 17% of white Forsyth County residents have gotten a first dose, and 4% of Hispanic Forsyth County residents. When you look at just looking at older adults, roughly over 50% of those 65 and over, regardless of race, have gotten at least their first dose. So overall, 15.4% of Forsyth County residents have gotten a first dose. So I think in that respect, we're doing good. We still are, like I said, working hard to get into our historically marginalized populations. Some of that is access, some of that is internet. It is very, we struggled early on about how do we do this? Do we open it up first come, first serve? We saw some counties and some states where people did that and people were waiting in line for 6, 8, 10 hours So we didn't want to do that. We did it by appointment only. And we're trying to, like I said, do more boots on the ground in the community to get appointments among, we have worked with Edwin, the first Senator Lowe at Shiloh Baptist. So working with Reverend Churn, Mount Zion. So really working some logistics, and maybe I'll let Edwin talk about, there is some challenges logistically when you go, it's not like a flu clinic. It's not like at Walmart when you get the flu shot. There's 10 or 12 people behind every shot, whether it's at the fairgrounds. We have over 100 staff working at the fairgrounds. We've given 45,000 doses of vaccine in 2.5 months. And
Wow.
more opportunities coming from the FEMA spoke out of Guilford. We'll be able to work through Winston-Salem State. And I'll also say, and I saw it in the chat, it's been a really good partnership with Novant and Baptist.
Right.
This weekend, we're offering 8,400 doses of Johnson & Johnson by appointment. It's already been filled. It'll be at the education building, but I'm happy to say that 30% of those doses right now, from looking at our scheduling system, are for historically marginalized populations.
Excellent.
So,
Excellent. So I will jump over to Ms. Harrison and then Mr. Marshall. So can you speak to that as well, and talk a little bit about Novant? And then I've heard this term before, equity doses. I know that's been a point of emphasis as well. So if you could speak from an Novant perspective,
Sure.
how are we doing?
Absolutely. First, I want to go back to something Reverend Brown said, which was our community is awesome.
Yes.
And so I'd like to take this opportunity just to thank the members of our community for showing up for us. We've had our team members catered through lunch. We've had cheering parties. We've had it all. And we really, really appreciate that. So I just want to thank the community for those efforts to help sustain our teams. Secondly, I'd like to say that it is a wonderful, again, opportunity to be fortunate enough to have a wonderful public health department, as well as another health care system, Wake Forest Baptist, within our own community. That alone is priceless, right? And so we are all invested every single day in our community and doing this work. And so it is just amplified when you can come together in a collaborative effort to serve the very same community. So I thank our partners from that perspective as well. Just yesterday, I was involved in one of what we call our pop-up clinics here in Winston-Salem. We administered over 501 doses for the vaccine. Our pop-up clinics have been very popular for us. They ran out of some of our local schools, as well as some of our churches that have been that have also been mentioned. Just the network that we find through the African American churches has been invaluable for us. And these aren't new partnerships for us. These are partnerships that we've held for a long time. Our community health and wellness teams have really always been in the community, kind of our boots on the ground to develop these relationships. And so they just really came in handy when it was time to really infiltrate the community with the vaccine. And so I think we are very fortunate, and we'll continue to do this effort. Our team is pumped and amped. We see the light at the end of the tunnel. And so it's been a wonderful opportunity for us to really begin this work and continue this work that is so important. At our pop-up clinics, kind of overall here in the community, about 60% of the patients that we've served have been African American. Unfortunately, only 4% have been Latino, but we are desperately working to increase those numbers with everyone else. And so I feel very optimistic about the work that will happen and continue to happen over the next few weeks and months. And I think in a few short months, we will all be able to breathe a sigh of relief as these efforts have concluded.
Absolutely. Thank you so much, Ms. Harrison. And thank you for highlighting that joy that is there in our communities, the relationships that people are rallying around, if you will, and wanting to see this pandemic end. And they're doing their part, whether it be churches, community groups, to do their part in making sure that everyone has the opportunity to be vaccinated. And they're just showing up and showing out, as they say. So Mr. Marshall, I know we spoke a little bit about this. going to have you start off our next section, but I want you to touch on as well, how are we doing in Forsyth County?
So we're doing fantastic. We've got an opportunity to go to several churches now within the surrounding area. Started out with Charlotte Baptist Church with Sarah Lowe, and that was our kind of pilot, just getting a feel for how we could logistically lay this out, and it worked very well. We were in the fellowship hall of the church, and we had an opportunity to serve about close to 200 folks that day, and everybody was enthusiastic. We have a great model format that when we have folks come in, we're able to provide education right there at the spot. Vetting anybody who might not be a candidate at that time, and work with them on rescheduling if need be, administer the vaccine, monitor there, and then usher them out. While they're there, they're also getting second dose appointment scheduling done as well. So we're handling everything within one go, at that visit. And so we have them coming up, they're 4 weeks out. So we have them coming up here soon for their next second dose. And then we've been doing the same thing for the other churches as well. Averaging about 300 plus doses per visit. So we're reaching a lot of folks. Our calendars are filled up, going into April. So things are going pretty well. Very well.
Excellent. Thank you. And so with that, as we transition to our next segment, I do want to leave a little bit of time for questions and answers. So if anyone in the audience has a question, feel free to drop those questions in the chat. We have someone monitoring those. But we're going to go into our next section. So if you could keep these comments relatively brief on how can we do better. So I know we touched on about what can we do better, excuse me. We talked a little bit about historical trauma and some of the issues that we've been facing as a state and in Forsyth County. What are those challenges? We talked a little bit about distribution, the digital barriers, things like that. So just keep those in mind. What can we do better? So I'll start with Mr. Marshall. What can we do better?
So far, I've noticed the number one barrier is access. A lot of times the registration process default is online, but and as we go through this, I'm learning that there's definitely a divide between the generations, right? So the older folks need a little more help with navigating the online process. The younger folks, they can do that. So we're trying to cater to both as we start moving to these different groups, later groups. So that's the number one thing. I don't have a solution off the top of my head, but I have been working with my team that we are presenting a hybrid type model to help cater to both groups of folks. That the 65 and up are still in need of getting vaccine, and then the young groups are now starting to come in that prefer the online. That we're able to cater to that. And that's one of the things, just providing a little bit more ease of access as far as registration goes.
Excellent. Reverend Brown, talk to us. What can we do better? I know you said we're doing excellent, we're knocking it out the park, but if you saw an area, where could we do better?
Well, I think that we're going to have to really look at the fine tuning of communication with our intentional populations, our historically marginalized people. Specifically speaking for the Hispanic Latinx community, some of the partners that I have in the community, are sharing that most of their people do not have email address. Now, we on the clinical side and working this side, we understand what CPMS needs and different things like that to get verification. And so some of those questions are very intimidating to that population. And so the messaging would be a key to try to figure out how we could utilize a more warm type of approach with the community. And then remember, as we come up with these new savvy ways of collecting data and getting information from the community, many of our marginalized people do not have access to those, cannot afford that smartphone, do not know how to access a computer. I had one of my elderly say, "Ma'am, I don't have a cell phone. You can call me on my house phone and leave a message." So she didn't know what an email address looked like. And so those are the challenges that we're having with our new technology, but then our old school for people that cannot, do not have access and funds to those things that make it easier to make things happen. So I think looking at that those ways, communicating, and we're really going to have to get the message out there still, and being more warm than like phone calls. Hey, have you had a vaccination? That's not going to get it. They need to see people, and they need to see that we care.
Absolutely. Absolutely.
And also that we're united. I'm sorry. And also that we're united and not all over the place, but united. Thank you.
Perfect. Perfect. Same question, Mrs. Harrison. What can we do better?
So one of the things that I think that we can do better and just kind of keep front of mind is not to forget about our seniors. Because I think as categories open up, I still feel that we have unmet needs with our 65 and up. And so I would just encourage everyone to continue to check on your neighbors and your family members that might be 65, to encourage them and help find ways for them to get the vaccine. What else could we do better? One of the things that I think about are people who have never received a vaccine ever. And if there is a way to overcome that. Is that more education? Is that more, just general conversation, but definitely having more conversation to the population of people who might not have ever had a vaccine before as to why it would be important to try their luck with this vaccine and to ensure their health and the health of their families. And so I think that we're doing a lot right. And we are learning a lot as a healthcare system. But I would just say just us being able to keep our resilience up in order to kind of keep this marathon going for as long as we need it. But I do believe that we are doing a lot of things right. But there are a few things that I do believe that we could do better.
Excellent. Excellent. And I'll come now to Mrs. Gail Perry and Director Swift very quickly and succinctly. What can we do better from a state perspective and then locally here for Forsyth County? So Mrs. Gail Perry, from a state perspective, what can we do better?
Two things I'll highlight really quickly. First is we just need more vaccine. I'm so proud of our vaccine providers, and I think we've shown that as a state we can deliver. Give us vaccine, we will get people vaccinated. So number one, we need more vaccine. Number two, I think to Reverend Brown's point and Ms. Harrison's point, we have got to make it easier for people to get vaccines. People who are not as savvy, who aren't going to shop around, who don't know how to get online. We have got to make it much easier for them to know that they're eligible for a vaccine and then how to actually get a vaccine. We'll keep doing work on that. And we're going to lean into our community-based partners who frankly are the ones who at the end of the day make things happen.
Absolutely. Thank you, Deputy Perry. Director Swift.
So for me, two things. One, the partnerships. You get better health through better partnerships. So we've already had strong partnerships before the pandemic. Those were made stronger, and then we have new partnerships. One group is the 20. They have been helping us since the beginning with our testing sites. A group of African-American men and women, business leaders who, they've helped us, we've helped them. It's been a great partnership. So I think, one is those partnerships. And then if I guess, just to put it in one word, is caring. When everything that we do, always think about our clients first, whether it's how they can make appointments, how we get information. We're not going to convince people with statistics. It's just walking the talk, showing people that we care. And something I said early on when the vaccine was rolling out, it's okay to be patient. I think we're seeing people that early on didn't want the vaccine, but now they're seeing friends and family members who've gotten the vaccine and they're ready to come in and get the vaccine. So just getting more vaccine out there, but also showing people that we care in the community. And, the health department, I have a placard. We've been here since 1916, so 105 years. So we were here before this pandemic, and we're going to be here long after that. And we want to listen to the community. Early on, I tried to reach out to Reverend Ford, Reverend Kane, a lot of the pastors, Reverend Churn, who we were just at Mount Zion. So to get to know the community, especially in the zip code that the health department's in.
Right.
East Winston. So getting to know and what the needs are.
Critical partnerships and relationships. Absolutely. All right. So we do have a question in the chat. Also, we do have a Facebook Live audience. So if there are any questions there, feel free to drop those in. So I have a question from Miss Taja Gaiman. She's asking, where do we stand with the trials for children to get the vaccine? Can you give an estimate of when the vaccinations might start for children? So any takers on that? Anyone? Vaccinations for children, and can we give an estimate of when that might start?
I can take it. I don't know that I can give an estimate right now. I mean, just as a reminder, you know, we've got our Pfizer vaccine that is approved for anyone 16 and older, Moderna for 18 and older. There are clinical trials that are currently underway to study vaccines in younger children. I don't know the exact timing of when those clinical trials might conclude. And I don't know if any of my health partners have any more updated information, but I know that those trials are underway, but currently 16 and 18 are the ages that the vaccine is available right now.
Absolutely. And can I throw this in there as well as you're thinking about it, in terms of if there's someone who's pregnant, how safe is the vaccine for someone who may be pregnant in terms of them getting vaccinated as well? Because I know the clinical test didn't necessarily include pregnant women. So I just wanted to see if you can also speak to that as well. So children and women who may be pregnant or nursing. Anyone? All right, Mr. Marshall, I think you're on mute. All right, I think we lost them. Director Swift, do you want to take that one?
Regarding the trials, I just know, you know, talking with Dr. Ohl with Baptist, who's also one of our medical directors, he's mentioned that sometime in the fall there's some there's plans to have some trials with younger individuals. I don't know the age ranges or the exact timeline. I think the great thing is when you look at our statistics, I mean, I can look at, we've had, like I said, 350 deaths. We've had no one under 25 has passed in Forsyth County. And the overwhelming majority is 65 and over of the death. So, I mean, that is the thing compared to other pandemics, like in 1918, when it affected younger people, the COVID-19 is affecting older individuals. But I am hearing those questions about people with young teenagers that are under 16. So hopefully we'll have information in the coming months.
Absolutely. We have a couple comments talking from earlier from Jen. Going forward, it would be great to see our healthcare providing partners to continue to collaborate, to lead the way, to work towards minimizing and ultimately eliminating health disparities within the African American, Indigenous, and Latinx population. We have another question. There are people asking if, excuse me, that people from different groups have been getting vaccinated without proof of group. So I'm guessing people who have been jumping the line in terms of the group. Is that okay, taking someone else's spot? So if your group has not come up yet and you are able to somehow get vaccinated, is that okay? Or should we wait our turn?
Well, I'll just speak locally. Has that happened? I'm sure that's happened. Here we've given 40, as of this morning, 46,949 doses. So that volume, you know, and two, I want to let people realize that we're not checking IDs. We're not checking employee badges, because we don't want to put up a barrier. We don't want to put up a barrier to anyone. But what we have encouraged people, because I've been asked this question by the media, is we hope that people would do the right thing. that someone would not want to take those spots or put in that, there was a lot of direction and detail and looking at the science to choose who should go first and the priorities. And so, I would hate for someone to do that. So, I mean, it's not okay, but I hope people understand that we're concerned if we did, we've been told by the state not to check, we don't want to check IDs because we don't want to put up a barrier to anyone coming.
Absolutely. Absolutely. I think Mr. Marshall is back, Ray. So if you can pin him back to the panel, please. So we did have a comment. Rod Smith, Director of Place Matters, says that the CDC currently recommends that women who are pregnant and part of a group recommend to receive the COVID-19 vaccination. If they have questions, that they can contact their healthcare provider. So yes, and if you have questions, contact your healthcare provider. So we want to go on this section. Okay, we have another question. People in the community that have been asked about locations and having a choice and what vaccine to get. Are there specific sites that offer particular vaccines, such as Moderna being offered at one place or Pfizer being at another location? So we'll jump to Ms. Hairston. Can you talk a little bit about the different vaccines that are out there, and should people be picking and choosing which vaccine is the best, so to speak?
What we've encouraged is that when your opportunity comes up, whatever vaccine it is, we encourage you to get it. And so, we're not trying to disparage any of the three. We know that they're all successful and they're all preventing COVID and they're all preventing death. And that is the main thing. So we are just encouraging everyone that whatever opportunity you have is to take it.
Absolutely. Absolutely. So we only have a few minutes left, and I know we want to be conscious of the time. So I want to end on a great note. So I want to know, where do we go from here? End of 2021, from a state perspective and a Forsyth County perspective, what does this look like? Are we able to get back to Thanksgiving with our families, Christmas with our families, end of 2021, or beyond? Where do we go from here? We'll start with Miss Deputy Perry, and then everybody just take a crack at it very briefly. Where do we go from here?
I predict that we will be able to have Thanksgiving with our families. The CDC just came out with guidance that said people who have been fully vaccinated can be with other people who have been fully vaccinated without mask wearing, and can be with one other household of folks who haven't been vaccinated. I think as long as vaccine supply continues and we don't see very significant changes in those variants, I'm going to go out on a limb. Obviously, all of us are going to watch closely as public health leaders, but I think we are heading towards being able to take control of our lives and get back to our lives, and we just need to stay vigilant for a while longer.
Absolutely. Reverend Brown.
I knew it. So I think that where we go from here is that we continue to do the wonderful work that we're doing out in our communities, ramping it up even more, preparing for the vaccinations that are coming, and coming up with more innovative ways to reach our community members, and going into those areas where they feel like they've been left out and left behind. From a church perspective, I think that where we go from here, I do see us getting back into church. I also believe that we need to make sure that as we go back into church, we're going to probably keep that this new way of technology, because persons have now who have the opportunity to have more access to church services via technology. We got to service those two groups of people. And so I see us going from here, doing new innovative ways of work, of churching, of fellowship, different things like that, and just really taking our ministries to a whole new level, and serving the ministries, keeping these ministries that we created for continuum. So I see that.
Excellent. We'll go, Ms. Harrison, where do we go from here?
Well, what I hope is that all of the collaborations and partnerships that we've been able to gain over the last year, I certainly hope continue as we dig deeper into health equity issues and issues of health disparities. I think no one can do it alone, but we can definitely get it done together. So I hope that that collaboration continues.
Absolutely. Mr. Marshall?
Um, I would like to say that, given our efforts in managing COVID vaccination and just protection within the community, it carries over into a population health model in medicine. So we're not looking at it just from a onesie twosie kind of one person at a time, but we look at the population as a whole and how we can further foster improvement in health in the community. So hopefully uses momentum to move that forward.
Absolutely. And Director Swift?
Yeah, to take what Edwin has said, and Edwin and I have had these conversations before, is focusing upstream. You probably heard that term, social determinants of health. Housing, jobs, violence, education, that all affects the health of the community. And it's not necessarily your genetic code, it's your zip code. And how can we change that? That's not going to happen overnight. It's going to take decades and generations to change that, but we got to start and working through those partnerships. As far as COVID goes, I think as we see more vaccine coming out, we're going to see less cases. We still can't let our guard down yet. And I'm hopeful, I'm ready to have Thanksgiving dinner like normal. But everybody says get back to normal. I think there's been some good lessons we've learned during the pandemic of ways to do things, whether it's efficiencies at work, whether it's, like you said, with worship. My church is just, I've started going back, my family, the last 2 weeks, spread out. They've taken precautions. Everyone wears masks, and that means so much. But there's also ways to get our message, whether it's through work or worship, out electronically, and some good things we've learned that we can take forward even after the pandemic.
Excellent. And I know we have a few questions in the Facebook chat. We'll try to email out the answers to those questions. I think we have one for you, Director Swift. Just want to, again, thank you all so very much for being on this panel. Again, thank you to you, Director Swift, along with Mr. Marshall, also Mrs. Hairston from Novant, Deputy Secretary, Ms. Gail Perry, thank you so much for being with us. And the person who I know I have a lot to give thanks to as well as Reverend Brown. Thank you for joining us today. Want to also give a shout out to my colleagues from United Way, Ray for working behind the scenes, and Kim, and want to also acknowledge Ms. Debbie Wilson and also Rod Smith for being on today. Thank you very much. We look forward to maybe having an additional follow-up of how we can continue this conversation so that we can continue to get our citizens vaccinated. So thank you so much. And we look forward to seeing you on our next Front Porch conversation. Everybody have a great day.
Thank you. You as well.
Thank you.
Thank you.